Again, this is my girlfriend Leah. She runs the IT department now.
Okay. Nice to meet you all. Please join us. Sean can tell you all about you.
I haven't.
So, I hope Sean's not being too hard on you.
No, he's been great. He's been great serving.
We're correcting a 17-year-old girl's tumorous breasts with saline implants. Dr. Allen told Dr. Andrews it was unethical. He got mad.
I didn't say it was unethical. I suppose I shouldn't have to do it. I don't know what tuberous breast is, but I think things are way overrated.
That's because your breasts are excellent.
That's exactly my point. Mine aren't huge, but every guy who's ever seen them up close and personal has been thrilled.
Definitely was. And I'm thrilled by every part of your body.
Sorry. My bad. Total TMI.
I'm not even bothered by your annoying voice, except when you talk to your mom on the phone, but I just put on headphones.
At least you'll know he'll be a totally honest boss.
The incision is extended superiorly to meet the atriotomy, and then the endometrial septum is opened after. The Carpathian retractor is used to visualize the mitral valve. And that will allow a clear view of the tumor.
Can we turn the channel? Color commentary is getting a bit annoying.
With the right atrium open oblique.
Steve Brown, any early standouts?
Jackson's a bit timid but smart. Walk is definitely enthusiastic. And
Timid
your skill
and
recruit is pretty full of himself.
For surgeons, according to his Rex, he can dissect and suture like a pro.
Help!
You really think you're
ਮੈਨੂੰ ਡਿਕਸ਼ਨਰੀ ਚਾਹੀਦੀ
डिक्शनरी च भी होली वर्ड्स नहीं मिलते हैं।
So what brings you out of this?
MIC over instructor, night school. What the road is.
shy never lacking the self confidence.
Help him be the best they can be.
Surgeons are the ones that I have that.
not planning.
I spent my life
It's all your code being
studying
in
the Talmud and
You're
not shaving
able
the
to
sides of my hair because someone up there supposed to realized no one's up there.
I want he was
No one cares.
that the digital
No
money.
benevolent higher power is going to us, so we have to save each other.
Can you tell? You're obviously smart. You've got 2 degrees from Harvard. Something went wrong.
Looks like we need the pulmonary artery.
No, if they had ground resection instead of when reaching their hands.
What are we doing now?
Nothing.
We can't access the tumor without compromising his entire cardiac outflow tract.
What about going in the way I suggested? The median sternotomy.
The tumor's too far back. We need to close him up.
Proton beam radiation would be too toxic to the heart.
So is immunotherapy. We can't access the entire tumor surgically, and we can't kill it without killing his heart along with it.
What if we cut out the parts we can access and try our luck with chemo?
Maybe doxorubicin and ifosfamide might slow the growth, given a few more months.
No, I'm not sending the patient home. It's just a few
Not an option. Heart tumor, contraindication.
What if he comes from his own heart? If we take it left behind and then put it back.
Not cool. At least with a normal heart transplant and a healthy heart. Her idea keeps the risk of removing the heart and adds the risk that the heart we be putting back in is just been severely compromised.
Very strong.
Do a cardiac MRI and see if the tumor's infiltrated the coronary arteries. If it hasn't, Morgan's idea could work.
I'll step away.
Dr. Murphy dividing the breast parenchyma into 3 petals. And you would know where this technique's derived from? Why would I use a breast reduction technique to make the patient's breast larger?
The technique frees up the tissue. You can bring the pedicles together to make the breast smaller or spread it out over the
Good. And now I'm going to turn the sound off. Don't worry, nothing wrong. I just want to talk about you behind your back a little bit. So, first impressions. Murphy?
I like Dr. John Lundberg.
I haven't even heard him speak yet.
He has the highest USMLE scores.
And that's important to you.
Yes. It shows he has a broad knowledge of medicine. Important to you.
I'm more interested in what they can do with their knowledge, which is why so far I'm most impressed with Jordan Allen.
You said she undermined you.
Which takes courage. So will serve her well.
Then why did you tell her to stop lecturing you?
Easier to teach an aggressive reservoir strength than a passive one to circumstance. What about you, Park? What's important to you?
I want to know who I can stand and be around for 80 hours a week. Everything I learned as a cop, you don't really know sense.
Awesome.
The lady in circumflex look clean. What's with the right corner?
Awesome.
It looks narrowed at the origin.
It's a bit narrow, but looks like a normal variant.
Some tumor infiltration. What do you guys think?
I guess
It's angiogenesis.
Awesome.
coworkers almost as annoying as mansplaining.
Otro.
Because even though we're in race, you don't always have to speak first.
I do not love the interruption. But I like the enthusiasm. What are you gonna say?
First, I'm not fast. Shifting from rectal circulation to feed blood to the tumor. Angiogenesis.
I got it. So we already should have been what you were gonna say?
Awesome.
He's causing radiographic scatter in this area. Name's just not.
She's right.
The BP's dropping.
Push flow, start IV compressors, check the bleeding. She's in VTAC, moving the crash card. No bleeding, no hematomas.
Charging. Clear.
Sinus rhythm. Her BP stabilizing.
Get her to the ICU. I want post-op labs, CTA chest, and full 24-hour.
Disregard what's
She's stable.
These don't pretty slowly and continue. With diagnosed metabolic disorder, intracontinental heart reaction.
Awesome.
I went to force and reversed the pillars with the significant with his wife.
smart, but risky. There's the stressor part. Plus, right, could rest again. I saw a similar case last year. Warn you, you interned in the hospital. I know. Volunteered at a Legacy Foundation. Our guy,
Awesome.
fell out of the tree, like he beat up.
How is falling out of the tree similar to using breast reconstruction surgery?
Well, he broke his back. But when we got up to the hospital, I found no sweat. And metabolic abnormality from iodine deficiency. Right here.
assisted in multiple heart transplants. Even sutured the atrial cuff in one.
I got to scrub in on a liver transplant once. The patient died.
What'd you learn?
Bile duct leaks are hard to detect in lungs.
Good. Next time I'd lead with that instead of the patient's death.
Are you all done yet?
Why?
Dr. Park wants everyone to join him in the break room.
Once thought it'd be fun as far with a pro boxer visiting my dad's gym. And that guy was Mike Tyson.
Yes, Mike Tyson?
Awesome.
Guy from The Hangover.
Thanks.
With the tiger and the tattoo on his face.
Nice. You've just revealed your crazy mold. I've seen the musical Wicked over 50 times. Since the tryout, Broadway, Chicago. I've even seen a friends with mentees in the United States or something.
Heard. Next.
I'm Claire Brown. I love music, but I hate musicals, and I don't really like to talk about myself, so it's Sean's turn.
My name is Dr. Sean Murphy. I used to not like music, but my girlfriend Leah, she changed my mind. I also like to watch the Weather Channel on TV. And I think pickles are disgusting.
Cops know how to manage up. Managing down's another story.
He's mature. Thoughtful. Doesn't have an ego.
Neither does Murphy. But do you think that qualifies him to supervise first years?
Murphy's smart. Brutally honest. Has no regard for social convention. Works for Bill Belichick.
The Patriots are the most corrupt, dishonest organization in the history of the NFL.
Seahawks suck.
Teddy no Tagro league
how's
ho
your
jayenge.
experience been here?
It's been good.
Did you consider any other programs, or was this your first choice?
This was my only choice. Why do you hate God?
Oh, actually, I don't believe there is a God.
I thought maybe it was because he believed he hated homosexuals.
I don't think this is something that we should be discussing at work.
Why not?
Because it's personal.
Do you have a boyfriend?
I'm sorry, but you can't ask that question in a workplace.
Dr. Park, he wants us to get to know you. How can I do that without asking personal questions? I have a girlfriend, and she is very important to me. It affects my life in every way.
Probably should have thought of that before you told her how much her voice annoyed you.
I said it didn't
Awesome.
bother me. It was a compliment.
What I heard is you criticizing her voice. And you bring down the gun too. You're trying.
What about Brown? Probably leader.
She could be insecure. Or certain.
कहाँ जा भाई जानू?
वाइब्रेशन नहीं की आवाज है
Yeah, I agree, which is why I went out of my way to get forward. he doesn't do a lot of pressure. Morgan, you need to slow down. You're not a surgeon. This is not your job. My job is to help my patient and then kind of treatment process. As an anesthesiologist, surgery is to sleep. My care is so that's what's important.
Are you mad at me? I said your voice doesn't bother me. This is a compliment.
Actually, what you said is that you love my breath so much that with the help of noise-canceling headphones, you're willing to put up with my annoying voice.
Yes.
Not a compliment.
So you are mad at me?
I'm not mad, Sean. I'm just busy trying to keep like $1 billion bots of numbers out of our network. Actually, no, I'm not doing that. I'm gonna go home.
You want to have some tequila stat? We also have some pizza left.
No, I don't like tequila or pizza.
That must mean you're mad.
I'm just upset and confused, and I really don't think there is anything you can do about it, so you just need to stop trying and leave me alone.
She's not mad at me. She's definitely mad. Usually hide what she thinks.
She's not mad at him. She knows how he is, how he talks. She's mad at herself. She's scared. You know something was a kid.
Awesome.
I hope that when we
Thanks.
go down it for the one person that doesn't see our flaws.
So, what do I do?
You're being honest. You can't apologize that way. Figure out what she needs to feel secure in the relationship.
Help!
Don't look at me. I'm single. My theory.
Awesome.
Can we zoom in on her skull base?
Awesome.
Yeah, but why? We're worried about her heart and metabolic abnormalities.
We shouldn't be. Not anymore. You and Dr. Murphy were both wrong. She doesn't have a cardiac or metabolic issue. She has poor blood flow in the artery supplying blood to the area of the brain that controls consciousness.
Small blood in her artery purse.
We don't remove it fast. She's never going to wake up.
दिल तो बगैर के जिंदा रखते नहीं.
No, it's not. The heart's totally outside of the body.
I need a muzzle.
It's still beating. It's like it has a mind of its own.
She should have started the reimplantation by now.
Is everything okay, Dr. Lim?
The tumor had tendrils invading the right atrial wall. We took so much tissue to get a bare margin, there's not enough left to reconstruct his heart's
देखिए
infiltrate.
मैंने ऐसा.
How about I take a PTA breath?
There's not enough atrial remnants in the
भाई दिल देख ला तुम. आओ बैठ लो.
Dense conduction
आओ
fibers
देख.
there.
He's got low arterial pressure.
He's training with this stimulation.
Is it believed this sort of caused by full-on bypass? We need to get his heart back from ASAP.
Morgan, we can put the heart back in two missing chambers.
We didn't do PCA. Killed it. Injected dissolving agent into the clot.
There's a 50% probability that one will dissolve, which could be really permanently physical. We need to remove the retriever.
If we
Awesome.
posterior cerebral arteries, so
Thanks.
or total recovery. That's how she came into this hospital. That's how she's leaving. Prep her for stem treatment.
Platelets and fresh frozen plasma, which are still in the toilet.
I know, that's the but.
How thick is this deep cachet? It was over 2 milliliters.
Morgan, get out.
I'm sorry, I'll be quiet.
No, you won't. You can't, so leave the OR gallery. Now. We need 2.6 millimeter thick tissue with perfect compliance for arterial filling and contractile pressures.
There's just the valve, we use bovine pericardial graft. But cow heart tissue is not durable to an entire chamber.
The pig bladder tissue is just right. I've used it for bladder reconstructive surgeries, but never hearts.
Let's rebuild the entire atrial walls with it.
Get down to the tissue procurement lab and get 200 centimeters of porcine bladder tissue.
सूर ले जाएंगे टिश्यू और ना अटैच कर देंगे मेरा कट होगा
Are EEG ductways are slowing further?
सूर दा
There's one vessel feeding her thalamus.
छी यार लानत है ना दे
Flatlanded where it did.
Approaching the artery of Pharoh. 1 millimeter from the clot.
Stop right there.
We disrupt this clot, cause a shower of emboli into her brain.
Awesome. Thanks.
Blood's flowing through the artery.
Brain tracing's looking better.
This should fill the gap between the inferior and superior vena cava and new chambers get sewn in. Where's that craft? I need more sponges. The bleeding is getting worse.
Is it 10K? Can you push heavy? I already did. He's maxing out. I'm running out of ways to keep his pressure up.
I got it. Say 205 centimeters of it. Thank you. If you want to down up, you can watch me down here.
Definitely. Thanks.
I thought telling her how much I love her in front of other people would make her feel good, but Dr. Gary said I made her feel insecure and scared.
Women are sensitive. When commenting on their flaws, total honesty is a high-risk procedure.
That sounds sexist. Aren't men also insecure about their flaws?
And much, much worse. And also, we're really stupid.
Okay, what can I do now? I've already said my stupid stuff. I don't want her to be upset with me.
I have a thought.
I think this run of sutures will hold it to being annulus, but I'm worried about leaks.
We can put a second row of budgeted sutures to make sure it's hemostatic.
That is unreal.
डलता नहीं हूँ गरीब
Heart. Now let's get it back in while we can still get him off bypass alive.
और this made the piece of
Freezing the heart.
We've got a rhythm.
टुक आधा घंटा तेरे को फोन है 5 मिनट रह गए आधे घंटे चो
यार 1v3 है
ना आया तू दिखाई मुंह देखना तेरा
ना करो
तू कौन हुंदा मैनू रोकने वाला
It was a complication. A clot which caused you to
Awesome.
performed a second surgery
Thanks.
on your brain, which was successful. You're gonna be fine.
But my breasts.
Clot occurred after we finished inserting the implants.
I think you're gonna be very pleased with the result.
Thank you.
I think I'm sorry.
Awesome.
Parents that
Victory belongs to us.
And Dr. Glassman said total honesty is a high-risk procedure. It's better to share my life than try to exploit